Good morning. My name is Jim Gilmartin with the ECCL. Welcome to the 195th meeting of the ECCL. Thanks for joining us today. We really do appreciate your time and interest. We are accepting questions at this meeting. At the end of each speaker's comments, I'll ask for questions and we'll try to get as many questions as we can. However, we may be limited simply because of time. We also are recording this meeting, as we've done the last couple, and it will be available on the ECCL website, if not later today, tomorrow, and you'll be able to see it in its entirety. At this time, I'd like to turn this over to Mark and just have a moment of silence. Mark?
Yes, please pause for a moment of silence for all those affected by the current pandemic. Thank you. Jim?
Thanks, Mark. Appreciate that. Okay, what I'd like to do now is introduce our panelists. Today, we're really fortunate to have two very enlightening individuals, people who have been involved in their world and have a good understanding of it. Alex Greenwood, the Vice President of Lee Health Coconut Point, and Adam Malloy, who is the Coordinator of Community Engagement for the School District of Lee County. Also joining us today is Mark Nowitzki. You just saw him. He's ECCL's Chief Operating Officer, and John Quinn, our Chief Financial Officer. So I'm going to get right into it now, and I'd like to just introduce Alex, tell you a little bit about him, and then I'll turn it over to him to talk about COVID-19 today and beyond. Alex, as I said, is the Vice President of Lee Health Coconut Point. The facility opened in 2018 as a health and wellness destination and a partner for residents of Southwest Florida. He's responsible for planning and coordination, the supervision of personnel, and the implementation of their strategic plan. Alex also responsible for the programming design and development of the campus and the new programs to serve the community. Alex, we'll turn it over to you.
Thanks, Jim. I really appreciate you guys giving me time on your agenda today. I think we have some important things to cover, so I'm going to get right to it. Really four takeaways, four things I plan to cover today during your meeting. I want to give a COVID-19 Lee Health update as an indicator of things improving in the community, I think, with the public health emergency. The second message is really we need to continue to remain vigilant, can't get complacent. We saw a spike in July because we think as a community we got a little complacent, but we've, I think, effectively address that, and I'll share some stats with you that show we're doing a little better. I want to talk a little bit about elective surgeries across the health system and also at Coconut Point, and that those are continuing and that they are safe for members of the community, and then give a general Coconut Point update to members of ECCL. So let's talk a little bit about the Lee Health COVID-19 update. I pulled some statistics. I know some people's eyes roll back in their head when I talk about statistics, but I think it's important. I wanted to provide basically today's COVID-19 update and then also reflect back on a month ago just to show what the trend is over the past 30 days. So as of this morning, we have 1,155 patients in our hospitals. That equates to 70% of our hospital beds are being utilized currently. Same time in July, we were at 86% utilization, so down significantly from last month. We have 232 COVID positive patients in the health system this morning. 165 of those are in the hospital. The remaining are in the Gulf Coast Skilled Nursing Facility. So that's a total of 232, and a month ago we were at 317. Our ICU utilization, our intensive care unit utilization across the health system is at 76% compared to 91% a month ago. And our ventilator utilization, which you hear as an important indicator across the nation, is at 33%. We have plenty of capacity at this point, and a month ago it was twice that. Another important indicator that you hear as we work through this public health emergency is our 14-day conversion rate. That is the rate of patients who are tested and come back as positive, COVID positive. Right now, over the past 14 days, our conversion rate is 16.9%, and a month ago it was at 27%. And those numbers are across the health system. and also consistent with what we're seeing at Coconut Point. So positive trends, absolutely positive trends over the past 30 days, and we believe it is a direct result of the community embracing the safety precautions that are widely known at this point. We have to continue to wear face coverings when in public. We have to continue to socially distance in a safe manner when in public, and also continue to wash our hands. If you're not feeling well, don't go to work. If your symptoms progress and you feel it's urgent, go to the emergency department. So hospitalizations are steadily falling over the past 2 to 3 weeks. We did hit a peak, as I said, in late June and into July. We hit what we feel is our peak, at least to this point. In preparation for season coming and possibly, in case the cases increase again in our community, we are increasing staff. We are bringing in traveling nurses. We've asked staff to come back from summer vacations and summer sabbaticals. We've also posted some new positions, and we have some new hires starting. So we do feel the good news is we have a capacity from a hospital perspective. Our outpatient facilities have plenty of capacity at this point, and also from a staffing perspective, we have capacity and continue to prepare. So it's a good story. The facilities are safe and well-equipped and prepared to take care of residents in the community. We do have to remain vigilant. We've been here before, right? In June, we saw what we thought was a peak, and the cases began to level off, and we got a little complacent in the community, let our guard down. As we were going all of us were going different places in the community, we could see that not everyone was wearing masks. And then we had that huge spike in July. It's the biggest spike we've seen to this point. So again, a key message, key takeaway, take it back to your constituents, take it back to your friends and family. Remain vigilant, remain diligent, continue wearing your face coverings, continue your safe distancing when you're around others and in public, and wash your hands as often as you can. Current trends are positive, but it can easily slip. We can go back to where we were in July. None of us want that, especially with kids going back to school. We have to take appropriate precautions, and it takes all of us. And we're doing a great job. We should celebrate right now. Take a breath, take a minute to kind of celebrate how well we've done over the past 30 days and just remain vigilant. I want to talk about elective surgeries. There's been a misconception a little bit since the beginning of this when we had to contract our surgery schedules, if you will, based on the governor's executive order. There's kind of a misconception that we're not doing elective surgeries. It's important to understand elective surgeries are absolutely medically necessary, but they give us a little flexibility on when they can happen. They're not those urgent surgeries, but they are surgeries that need to happen, like joint replacements, things like that. So we have some flexibility. They're not urgent. During July, when we saw our peak and we were concerned about capacity with the statistics I just mentioned to you, beds were getting full. We were concerned we may not have enough beds as patients were coming out of surgery. So at that point, we slowed down surgeries a little bit, limited them mostly in the hospitals, the outpatient facilities, including the outpatient surgery center at Sanctuary, our other ambulatory surgery centers, and the surgery center at Coconut Point continued business as usual. But we did slow down surgeries a little bit at that point, but that has returned. We're very thankful to the community, the patients who were scheduled and allowed, partnered with us in allowing that flexibility, understanding they didn't have urgent cases. But again, medically necessary to improve their quality of life. And we've caught up on those cases, and we continue with regular elective surgery schedules at this point. It is safe to have surgery at our facilities. All the patients are screened prior to surgery, and any patients who are over 65 years old get a COVID test. Any patients who have the existing health conditions that are mentioned by the CDC get a COVID test. Any patients expecting to be admitted into a hospital will get a COVID test prior to surgery, and any patient coming from a skilled nursing facility will have a COVID test prior to surgery. Moving on to the Coconut Point update, I want to talk a little bit about our emergency department trends because I think it is consistent with what Lee Health has seen. It's also consistent with what we're seeing across the community as an indicator of how this has been going with the virus. So pre-COVID is what I like to call it. In the month of February, we were seeing about 70 patients a day in our emergency department, as busy as we've been since we opened in December 2018. In April and May, as people were becoming more aware and learning more about the COVID virus, we were down to about 30 patients a day, so things slowed down significantly. That's also the time when we were limiting surgeries based on the executive order. In June and July, especially in June, when we felt like we had seen that peak, I think members of the community felt it was safer to address whatever health conditions they're having, and they were coming back to the facility, and we were up to 50 patients a day. And then in July, we started to have that peak, started to have a higher admission rate, started to have a higher conversion rate, close to 30% at Coconut Point in the month of July, and we were up to about 50 patients a day. Now that we've moved past that peak that we had in July, we're into August, and we're back to about 30 patients a day, sometimes 35. Our admission rate has normalized, so patients being admitted from our emergency department and transferred to a hospital is down close to 20%, maybe a little bit lower than 20%, as it has been since we opened, excluding the peak. And our conversion rate is about 17% since the 1st of August, which is consistent with what we're seeing across the community as well. I want to talk about our physician practice as well, multi-specialty physician practices, up to 20 physicians there a day. We are reopened. We closed during the month of April and May appropriately and relied on video visits or telehealth visits. They were very well received, extremely popular with residents in our community, and we plan to continue to offer those as an option. But we are reopened, and our volumes are back to pre-COVID levels. Visits and examinations are back to pre-COVID levels. Our diagnostics areas, radiology and laboratory, remained open through this entire public health emergency, including for outpatient scheduled visits. And the patients in those areas are returning as well. They're getting very busy and returning to pre-COVID levels as well. The reason I think residents are feeling safe coming back to our community is because at Lee Health Coconut Point, with the partnership of our residents, did a fantastic job. We can't say we're a COVID-free facility, but we have really minimized exposures and minimized the rate of COVID for our community. PPE supplies are strong across the health system and at Lee Health Coconut Point. We are monitoring those levels daily. I get a report every day that talks about how many we have on hand of each item, and also talks about the effectiveness of our supply channels. And so far, so good, although it can be tenuous, so we keep an eye on it daily. And again, I wanted to talk a little bit about the COVID precautions. If you were to come to Lee Health Coconut Point, every employee is screened prior to coming to work, including a temperature check. All visitors are screened, including temperature checks. We are limiting visitors to 1 visitor per patient or per guest, which I think is still appropriate at this point in the public health emergency. And we have kind of redesigned some of our waiting areas to support and enable social distancing. So our solarium on the first floor, which runs the length of the facility, is the seating is socially distanced, and also our lead physician group waiting room is socially distanced. Those are really the 2 waiting areas, other than the emergency department, that are open at this time. I want to talk a little bit about what's coming. You know, we understand the priority is the public health emergency and partnering with the residents in their health and wellness in that way, but we also have new services coming. Business continues. We have to continue to bring new programs for the community. We have an occupational medicine practice coming any day. It's opening at Bonita Health Center. We found one thing that became very clear is we can do a better job partnering with the businesses in the community and offering them preventive services and also services when an emergency happens for their employees. We learned that pretty quickly, so we're going to stand up an occupational medicine practice in BHC and offer those services to different employers, any employer that's interested in the community. We have a rheumatology practice that's going to be opening this summer. We have behavioral health coming in the fall. We have new physicians still recruiting and have new physicians scheduled to start at Lee Health Coconut Point and Bonita Health Center in gastroenterology, primary care, and in orthopedics. We have plans in year 2021 to bring an endocrinology solution to the community. And currently, our observation unit, which is the 9 beds adjacent to the emergency department, it was appropriate in early May, actually April, in the month of April, to close that observation unit. So we haven't been leveraging that observation unit to this point, but we plan to open that in the fall and be prepared for any increase in visits starting in the new calendar year. So our partnership and commitment with the community continues. We're working really hard to keep you safe and healthy and informed in the community of South Lee and North Collier. And we're going to continue to bring you new programs and be your partners in health.
Thanks very much. I do appreciate that. Let's see if there are any questions out there. Any of you out there, if you have any questions, you should be able to hit a little blue hand on the bottom of your screen. Do that, and we'll pull you in and ask your questions. Okay. I'm looking now at the participants, and okay, Michael, you're on. What's up?
Are you able to hear me now?
Michael, there you go. Can we hear you? We can hear you now.
Okay, great. Mr. Greenwood, I have two questions. One, Jim, I sent you an email earlier this morning. You probably didn't get it in time. You know, with all the effort that went through from the citizens of South Lee County, the civic leaders of South Lee County to get approval for a hospital, it seems like, as I understand it, basically that approval is given. There's no obstacles anymore, but we've heard nothing at all about a hospital, full service hospital coming. That's my first question. My second question is, you know, it's unfortunate when Dr. Weiss, who was the CEO of NCH at the time, decided to compete, you know, literally right down the street, you know, with the emergency services. But I understand things are much more amicable now that he's left, and you have a much better relationship with that hospital system. Is there ever any talk about NCH giving up the emergency room there, using it for other services that they are, and, you know, and shifting that over to Lee? I mean, it seems, you know, I know there's lots of discussion in the past about that. Kind of crazy to have two emergency rooms literally, you know, a couple blocks away from each other. That's my two questions. Thank you very much for listening.
Thanks, Michael. Alex?
Yeah, I'll start with the second question. So the relationship with NCH is better than it ever has been. Our executives and their executives, our leaders, staff are communicating and working together, collaborating to keep the community safer. We believe we're safer together. You've probably seen that tagline. But the reality is that's been our priority. Honestly, we haven't talked a whole lot about strategy beyond that, including the emergency departments. I think there are opportunities moving forward for us to have some of those conversations, probably really starting with regional programs like the Children's Hospital, how we can work together to take better care of the Collier kids, things like that. So we haven't really talked about the emergency department at this point. First question about the hospital. Yeah, so when CON was repealed, that did offer us the opportunity to proceed with the hospital. We have assessed that. We actually do continue to assess that based on the demand and what we believe is the utilization of the need for hospital beds based on utilization. It also really changed the marketplace in a sense that now we're a much more competitive environment. So if we had received certificate of need solely, we would have been able to build a hospital bed and been the only hospital beds in the community. Now we have to take a look at the entire community and consider what it would look like if a competitor like HCA, who owns land north of Coconut Point, were to build a hospital, et cetera. In current state, we believe we are providing a much safer healthcare environment for the community with a 24-hour emergency department and all the comprehensive services that we provide. We have a streamlined process to move patients from our emergency department at Coconut Point to our centers of excellence in Fort Myers, and that will not change. If and when we do build hospital beds, we won't be a center of excellence for cardiology anytime soon. So chest pain patients will always, just as they are today, be moved to Health Park. Stroke and neuro patients will be moved just as they are today to Gulf Coast Medical Center. Children will always be moved to Golisano. So we believe we're providing 90% of what the community needs from a healthcare perspective right at Coconut Point. And if you add in those transfer centers, we think we're doing a pretty good job. But I will tell you, I believe there will be a time where beds are required But currently, we're doing fine from a capacity perspective. We just added a couple hundred more beds at Gulf Coast Medical Center, and we're working to staff those. And that's kind of where we are with that.
Thanks, Alex. Any other questions? Okay. Donna Sutton. Donna, you're on.
Alex, I just wanted to know if you guys have discussed or decided on anything with that parcel on 41 and Coconut.
Yeah, that's a good question, Donna. So we have engaged Dover Cole, who are urban planners who have really successful stories from different planning engagements across the country, including some that you may know in Greenville, South Carolina. There's some in Atlanta, Charleston, and other areas across the country where they've been really successful. So we've engaged them. The Village of Estero has also engaged them for some planning they're doing, so we're going to work really closely with the village. We still have the same very high-level plan for that plot of land to be kind of synergistic with Lee Health Coconut Point, but offer multi-use solutions. And we really haven't narrowed that to this point. To be honest, we've really put it on pause through the public health emergency, and we'll fire that back up in the coming months, I think.
Hey, thanks, Alex. Any other questions for Alex? Okay, let's move ahead then. What I'd like to do now is introduce Adam Malloy. Adam Malloy is the coordinator of community engagement for the School District of Lee County. He was born and raised in Fort Myers and attended the University of Florida. Prior to taking his job in community engagement, he taught U.S. history for 12 years at the North Fort Myers High School. His research interests include history and the development of student assignment plans, demographic trends in post-unitary districts, and the history of desegregation in Lee County. So he's going to talk a little bit about school opening plans. You're on, Adam.
Thank you so much for having me. I'm excited to connect the Estero Council of Community Leaders with some of the details regarding our reopening plan. If we don't have enough time for question and answers, or if you ever have any concerns, you can always email me at adamcm@leeschools.net, and I'll try to research the answers as best as, or questions as best as I can, and get back to you with some answers. So I'm going to share my screen now and walk you through some of our reopening plans, which were created through a lot of collaboration and hard work with our community stakeholders, with our local health leaders, and with our reopening task force. All right, wonderful. So we are stronger together, and I wanted to make sure that you guys recognize the essential collaboration between the Estero Council of Community Leaders and the School District of Lee County. I don't see the reopening working to the extent that we want without this essential collaboration with your organization and other community stakeholders that are out there. Just an overview of the presentation. I am going to talk about our stakeholder input, because I do think that that's a huge part of this organic process. The reopening models that we provided for our parents and for our community. I did want to go over some of the parent selection data, as I do think that that's going to be very revealing as it relates to building capacity and how we'll be able to leverage building space for our safety and health protocols. And then some of the organizational agility, some things that the school district had to pivot on late in the year, and as the crisis continued, how we had to continue to adapt. Some of the support for teachers, and I know that a lot on social media, and social media is what it is, but some of the support that we've been providing for teachers and the connection that we have in our collaboration with our most important part of our workforce. Our superheroes in the classroom, and then some next steps, and then I'll be happy to answer some questions. So in terms of how this reopening plan came together, we went through a number of avenues to try to work with the community, whether, emailing parents or Facebook Live events, sending out surveys multiple times. The context of the crisis continued to change. So we continued to send out surveys, including to our staff. We were a part of a number of outreach to try to gather as much information as we could regarding our staff and their interest in coming back to the classroom, their concerns, and then trying to work together with them. Now, there was a reopening schools task force, the subcommittees, the meetings, and then the reopening models. Those were eventually influenced heavily by the governor's order, executive order, which discussed providing the full array of services 5 days a week if parents so choose. So we did adapt, in especially that hybrid model that was originally proposed for middle and high school students. We really could not have done any of the reopening models without our local health leaders, from Lee Health to our pediatrician groups. They were essential. This was, I think, to me, one of the biggest success stories of us pulling together as a community. The daily pandemic briefings, the working with the Florida Department of Health, the letters of support for our health and safety protocols from Island Coast Pediatrics or, PPC. We really had a lot of support for our toolkit that we eventually produced. And if you go to leeschools.net, there is a reopening schools information, and it's much better organized than it was a few weeks ago. It's in accordion style, and it basically broke down our toolkit that we put together based on research and input and all the different things that we were working on the past few months, and it broke it down accordion style. And I can maybe show you guys at the end of the presentation. Now, in terms of our support for teachers, I do think that this is something, that I really wanted to express, that we are doing our best to match our concerned teachers and those teachers that may have some underlying health risks with the different virtual options that we have, whether it's Lee Home Connect or Lee Virtual School. So we are trying to do our best to leverage our models to help our teachers and get our teachers connected with the best instructional model that we're providing. We did do a really cool new teacher drive-through and orientation. Over 350 new teachers were hired, and the different trainings that they're being provided. So teachers right now go back the 18th and school starts the 31st. And the training this year will be unique in that we will be training a large number of our staff to be teaching the Lee Home Connect model in terms of best practices. And just an update from Dr. Spiro, our Chief Academic Officer. He has put together a Lee Home Connect teacher task force to develop instructional continuity plans and best practices and how this is going to look. We're also in communications developing some parent universities virtual, similar to this style, where we can best educate our parents on how to navigate how to navigate. Sorry, the lights went dark in here. There we go. How to best navigate these instructional models. Now, these were the 4 models that were provided: the face-to-face option, 5 days a week with the full array of services, heavily guided by health and safety protocols, social distancing, and now with our mask requirement. And we do get a large number of questions about the mask. Like Mr. Greenwood mentioned, it's kind of our approach based on our collaboration with healthcare for reopening schools to do the best that we can in terms of mitigating exposure through the wearing of masks. And we're actually going to do a community mask drive in conjunction with the community to try to show some support for our students by collecting reusable masks. And that actually starts on Monday, and we're going to be doing some promotional material for that. Now, the Lee Home Connect, that is new. That's where students are paired with a teacher from their school for at-home, full-time online learning, and they can return to their school, their assigned school, based on the principal's discretion or at the end of a grading period. And we'll break down the numbers for Lee Home Connect, but we did have a large number of students that selected that option. Lee Virtual School, students are enrolled in a full-time virtual school. Lee Virtual School has now become the largest school that we have in our system, and I'll show you that those numbers on the next slide. So in terms of the parent selection data, we had a great response in terms of the instructional models. We had well over 75,000 of our students, and you can see the percentage breakdown. Now, do notice that the undecided 11% will be automatically registered if they don't choose into the face-to-face model. So we are looking at about 40, at the highest level, about 49% face-to-face across our schools. And that will allow us to greatly leverage our building space, provide social distancing, and get through this 5 days a week with the full array of services. That 37% at Lee Home Connect is very high. And that's something that we are going to be transitioning. Our distance learning that we went into was a crisis pivot, and we're looking to really increase the instructional ability with the Lee Home Connect model. And that's something that's going to require our Lee Home Connect task force, our academic team, our professional development team. And I'm excited to see the difference there from our distance learning, which was what I considered a crisis pivot, and still very agile there. But this is going to be something I think that is going to be a novel way, to instruct. And certainly as we go through this school year, and with the flexibility that's going to be required in terms of quarantining and maybe shutting down, sanitizing a class here, or possibly a grade here. And in terms of those worst case scenarios, we're hoping that Lee Home Connect can provide that framework of a better online and distance learning option.
Adam, before you move off that slide, we're talking almost over 90,000 students and approaching 100,000 here in the next couple of years, right?
Yes, sir.
Okay, thanks.
Yeah, the 75,000 respondents are really roughly out of about 85,000 assigned to traditional non-charter schools. So that 95,000 number is under our entire district umbrella, but that extra 10,000, 11,000 comes from our charter school enrollments, and they worked with their own charter school. That they're independent
Yes.
in some regard, so they developed their own reopening plan. So yeah, the 75,000 out of 85,000 I thought was was a positive response rate. But you're right, we did not we did not get all responses, and we're working. We're doing home visits. Each school is reaching out to those students that did not respond to try to figure out what their selection is for their instructional model. So there are a lot of efforts going into trying to get that undecided 11% down.
Thank you.
So our health and safety protocols, and not to be too repetitive here, the cleaning and hygiene is going to be key, and those have been aspects of our training and of our bargaining with both TALC and SPALC. The face covering mask requirement, we think is going to do a decent job of mitigating exposure, hand washing and sanitation, and also handling suspected presumptive positive cases with our isolation rooms, and then our flow charts that we've created for dealing with those presumptive positive cases. Our PPE is going to be provided to both staff and students. Our disposable masks will be provided to both staff and students. I think, like the community, we are excited about this new school year, but also the unknown. But I think for the school district of Lee County, what a great opportunity to be a bit disruptive from some of our traditional approaches, and to really maybe break new ground as it relates to both student safety and instructional models. So I am excited about maybe the unique nature of this crisis. Now, I did want to show you guys just a real quick video, because I think our team in communications did a fantastic job. This will show you guys some of the aspects at school. Okay, great. And I just wanted to reiterate as well that we do update our fact sheet on our school reopening page. It has some of the most frequently asked questions, including we do get a lot of questions about wearing masks outside for recess. Students will not have to wear masks outside at recess. They will be allowed to take their masks off. Our expectations are contextual at each level for elementary, middle, and high. We are going to teach it as a procedure of the day, but we understand that we are dealing with our kids, and we want to make sure that our community understands that, you know, that we are aware that these are children and they need to enjoy school, and mask will be a new part of that experience. Okay. Now, in terms of our reopening toolkit, I did mention that we have all of this information accordion style by topic. I was really proud to work on the team that produced this toolkit. I thought it was unique for our district in terms of its approach and how comprehensive it was. But yeah, I would love for you guys to give it a review and shoot me any questions that you might have. It is broken down up on our school reopening page through leeschools.net. Okay. This is one thing that Dr. Atkins has been really big on, and I'm sure a lot of your businesses and friends and community members, is the organizational agility that has been necessary during this time. One of my, I think, things that I'm most proud of for the school district is their continuance of providing meals with summer break spots over the course of the pandemic, and then over the course of the summer. You can see there that I think updated last week, it was over 1.7 meals that were provided. A lot of families, a lot of underserved areas were hit very hard by COVID and continue to be. And this is something that we always have to keep in mind, that schools are not just providing high level instruction, but they're also providing an array of services that are essential for our kids' nutrition and for our kids' social and emotional health. Graduation, was something I think that the district tried to be as agile as possible. I don't know if you guys got a chance to see some of the pictures on social media of what each school site did for that, but it ended up becoming very personalized and very celebratory. And, ideally, we would have loved to have our traditional graduations, but there wasn't much that was traditional about the ending in the past school year. Now, the amendments to our safety protocols continue to be daily, the daily conversations with our local health leaders, Florida Department of Health, our communication plan for getting information out to parents, whether it's traditional avenues or whether it's more virtual parent-style universities. We are planning to start school on August 31st. And you guys can see the new updated amended instructional calendar there. And then ending school, a little bit into June. Now, our support for teachers, this is key, matching our teachers with the different instructional models, whether it be Lee Home Connect or Lee Virtual School. That's been a huge undertaking, as you might imagine. You're dealing with over 6,000 teachers, some of which are very concerned or have underlying health risks, and having them matched up with the proper model. Our new teacher orientation, I mentioned over 350 teachers hired. And then our different Facebook Live events. We did a staff-specific one, and then we did 2 Facebook Lives with our community, relative to the reopening. Now, professional development will be key in terms of supporting our teachers, but everybody at the district, and myself being a 12-year educator, we realize how important our teachers are as superheroes in the classroom, especially in this difficult time. Now, here are our next steps, and this is where I will close. And I do apologize. I know it was a lot of information, but we're in that August. Professional development related to reopening is provided to teachers and school administrators. Teachers are going back next week. We support them and make sure that we share our support for them. And then August 31st, is the start of the 2020-2021 school year. A unique school year for sure, but I think it's going to be something that we're going to be proud of, that we got through it together, not just at the district, but with our community partners. So thank you guys so much again for your time, and please do not hesitate to email or contact me down at the district. I understand that we cannot do this alone, and that it really takes the support of a community for our district to operate at its highest level.
Thanks very much, Adam. Would you mind repeating your email address?
AdamCM at leeschools.net.
Okay, thanks again. Folks online, any questions for Adam?
I just kind of have two comments. Adam, we appreciate, everything the school district has done, and you've learned a lot of lessons. So are you putting together kind of a lessons learned book? Because it might help us in other areas. And one of the things I think Chris or somebody mentioned to me, Chris Patrica, was Wi-Fi hotspots. We gave out Chromebooks, but not everybody in every neighborhood has access to Wi-Fi. So you had to go do that. So, people don't understand. And that was a cost. That was something you had to do to get the students to be able to work at home and other things. So, maybe some point in time we can work on a little sharing lessons learned and how that, because it might help, other people be connected. And, maybe one day down the road, we can have you and Chris come in and talk to us a little bit about the 2 new schools that are coming in Estero here. So, and that's all I have. Thanks.
Thanks, Mark. How about any of the participants? Any questions for Adam? Okay. I do have a question, though. I'm going to go back to Alex. Alex, we got a question. I got a question from Anthony Rossi, and I'll just summarize what his question is. Will the healthcare system and primary hospitals in Lee County be prepared to handle the huge influx of seniors when they come back? Now, we don't know how many are going to come back, whether there's going to be a lot of traveling, but that was one question. Do we have enough ICUs in Lee County to deal with the addition of the significant, a larger number of people? Those 2, any thoughts about that? You're
muted.
Can't hear you. You're muted.
How's that? Better?
Okay, good. Thank you.
That's okay. I'll start with the second question. We believe we have certainly in the ICUs we have capacity. This morning we're at 76% capacity, even at a point when we had a 30% conversion rate. 30% of the patients being tested were coming back positive. Even at that point, we had capacity in our ICUs. So we believe we're okay there. And then as far as preparing for a surge, whether it's related to COVID or related to season, we also are more prepared than ever. We have additional beds at Gulf Coast that opened up a couple months ago. And as I stated earlier, we have plans to staff those beds. We're bringing in travelers. We're bringing in a newly hired staff that'll be working for us full-time and permanently. And we also have some folks that are out on summer sabbatical and summer vacation, which we do every year, frankly, and they'll be prepared to come back as appropriate.
Thanks very much. I appreciate that.
I have one more question for Alex. I got a text. One of the things I would love to see in others is a medical school tied to Lee Health, Lee Coconut Point. And I'm not looking for an answer today, Alex, but when you kind of come back in a couple months and we talk about that 40 acres kind of catty-cornered, the Coconut and 41 there, maybe you can give us some insight, into how you're working with the area colleges and schools and stuff.
We can do that. I can certainly get the information on that, and I'm certainly willing to come back and talk specifically about that and bring some friends with me that know more about it than I do.
Thank you.
Thanks.
All right.
Thanks, Adam. I appreciate your comments, and Alex, for your comments as well. I'd like to take us now into more of the ECCL type of activity. It isn't going to be much longer, but many of you who are involved with the ECCL and those of you who are new to the ECCL may be aware that we've gone through a transition in the last year. With the retirement of Don Eslick, there's been a number of changes taking place, including the management, the leadership, and so on. You're seeing some of it on your screen now, and there's others that we're not showing on the screen, but have been selected to deal with our basic pillars, which includes community development, culture and recreation, education, environment, health, transportation. Those folks, a number of those people are new as well. Also, what's been taking place is that we've created a board of directors that's made up of 9 people. And recently we've appointed several of them, and I just want to give you an idea very briefly of who they are. If you go on to the website, steriltoday.com, you'll find out more detail. But the first one is Rachel Pierce. Many of you may know Rachel Pierce from her activity on NBC2 mornings. She transitioned from her 19-year TV journalist career to pursue her growing art business. She said her final farewell as the NBC2 morning TV anchor at the end of June. It allows her to pursue her artistic passion and to be home with her children. Rachel has indicated she's really thrilled to join the ECCL board. She too wants to keep the Estero on the path of a wonderful place to live, work, and play. Also, we've asked Sally Ricciardelli to be a member of the board. She was approved by them unanimously. All of these have been approved unanimously. Sally is an experienced branch manager with the Bonita Springs Lake Michigan Credit Union. She was born in Maine. Sally moved to Florida in 1998 and is now entering her 23rd year in the industry. She also served as a branch manager for Encore Bank and JP Morgan Chase. She enjoys volunteering and considers it her obligation to sustain and improve our communities. Last is Melva Borley. In 1989, after an extraordinary corporate career in sales, construction management, and real estate at IBM, Melva was confirmed by the United States Senate as a presidential appointee with a budget of $250 million and a staff of 24. In 1995, Melva opened Melco Inc., and in 2011, Florida Governor Rick Scott appointed Melva as a board member for the Florida Keys Aqueduct Authority. Melva loves to volunteer, mentor young girls at the Boys and Girls Club and the Pace Center for Girls. These are 3 new members that make up a 9-member board of the ECCL. That is a dramatic change from the past, and we think it's going to build on the terrific foundation that previous leaders built in the ECCL, and we just wanted to give you some insights into that. You can find out more at estero.com. It's been a revised website. We think you'll find it easier to navigate, and you'll be able to get the kinds of information in much more detail that I just talked about. Okay, are there any questions on those board members, those of you who are participating? Okay, so let me reintroduce Mark, and Mark's going to talk a little bit about some of the ECCL Advocacy Council activities. Mark?
Thanks, Jim. Making sure we're working with our area elected leaders, we were pleased that the Lee County Board of County Commissioners voted to purchase land for conservation. So we sent a letter thanking them, figuring we'll get a little goodwill on that. The Culture and Recreation Council's working on a future Art in the Park event over behind Estero Historical Society. The Community Development, Anthony, the chair there, he spoke Wednesday night at the Village Design Review Board in opposition of the Clean Machine Car Wash. He was one of 12 or 20 people that spoke. We're worried about safe school bus zones, people safety, noise, traffic, and impact to home values. The Health Council, they're meeting with the Estero Fire Rescue and San Carlos Fire Rescue on their Fall Prevention Committee. It's on the 18th of August. Contact Mary Jo, I'll give her email in a minute. And the Health Council meeting is the 24th of August. It's going to be a Zoom meeting. If you're interested and don't get an email, contact Mary Jo McLaughlin, MJMACLAUGHLIN at ECCL Health or .ECCLhealth@gmail.com. The Transportation Council, on the website, there is a section for each of the councils. And on the transportation, we updated the number of homes spreadsheet in East Corkscrew. That number's growing over 10,000 and they're building more homes every day. It puts a strain on Corkscrew Road. So we want to kind of put that in relationship to the widening that's happening coming up here. In education, Jeremy's and his team's working on how do we provide junior achievement in the schools without being able to go into the schools. And junior achievement is so important: financial literacy, job skills, economics, entrepreneurship. We also updated with Lee District Schools Help an infographic on where the kids are in South Lee County. And I saw this graphic 4 or 5 years ago, and it was just, it just shocked me where the kids are. So right now, if you look at it, it's really big red in Bellaterra, it's pretty big in Stony Brook, and the place is growing like crazy as red. So it gives you some idea where the kids are, and then tons in San Carlos and Bonita, and then why we need the 2 new schools in Estero. Also, we're starting a drive for a back to school donation drive that Jeremy's putting together. If you're interested in donating or helping, he's Jeremy, Jeremy, at navaed.com. Okay, an e-blast will be coming out soon. And lastly, if you haven't voted yet, I encourage you to vote. We're non-political, we're nonpartisan. Just exercise your constitutional right and vote. Thanks, Jim.
Thank you, Mark. Appreciate it. Any participants have any questions for Mark? Okay, we have one person, Joyce Johnson. Joyce, you're on. Joyce, you have to remove your mute. There you go. There you go, Joyce.
Thanks, Mark. And just in addition to the Transportation Committee report or Council report, in the fall, I believe there's going to be some activity of adopting a highway program.
Yes, there is. And you're stealing John's thunder there a little bit. John's going to talk about that in a minute, and we got an e-blast coming out. But thanks for bringing that up, Joyce, because absolutely.
Yeah, thank you, Joyce. Take care. Okay, let's go on then, and I'll introduce the Adopt a Highwayman. I'll introduce John Quinn, who's our Chief Financial Officer, and John will talk a little bit of some finances and a little bit more on the Adopt a Highway program, which is really neat. John?
The month of July, we were $1,000 favorable versus spending. Our current funds exceed $20,000. This should be able to carry us through for the next 5 months with some reserve going into next year. And that was our hope. And we appear to be able to accomplish that. The Advocacy Foundation had 2 grants for $1,250 issued. One was to Echo Voice, and their website is echovoice.com. They're an environmental group, and you might want to visit that website. It's very interesting. The other is Estero Forever, where we made a grant. We are working with the Southwest Florida Community Foundation, and they are supporting us. One of the issues we have, and I'm new with the organization, is having to put a finance council together. We are not talking about monthly meetings. We're talking about developing some resources. So if you're interested, if you think you could support, either we use QuickBooks for the accounting, or fundraising, or grant writing, or anything along that line, I'd really appreciate you contacting me, and we can discuss this. I look forward to hearing from you. Adopt a Highway. We have been blessed by the fact that a young lady by the name of Julie Yangling has volunteered. She's been wintering down here in Florida for 11 years over at Pelican Sound. This past year, she volunteered herself to go up and down Highway 41, clearing debris. And she's been doing it on her own. She's been contacting doors as far as local businesses. And she made an outreach to ECCL. In May, the board approved us, and we applied to the DOT for an Adopt a Highway program. So starting now, the signs are up, and if you look at where the Vines entryway is, down south all the way to Coconut Road, that's 4.3 miles, and we've committed a 2-year program to support that. The very first date is going to be October 24th. What we're looking for are residential communities members to volunteer and help us put groups together. We're looking at putting a group of 8 to 10 people, and we'll have a couple of cars and support. We're provided materials from the DOT. It's a great program, and you get a little exercise to boot. So we appreciate that. You can reach Julie at ECCL HWY41@gmail.com. It will be posted on the website, and we'll be blasting some additional information very soon. I'm very excited about this program. It's an activation program for our civic group, and we look forward to working this program out. Thank you.
Thanks, John. It is a great program, and we hope folks that are participating and listening and see perhaps the recording will again reach out and offer some of their time to keep our Estero beautiful. It's a 4-mile stretch, both sides of the highway. We hope we hear more from you. So again, thanks, John. I do appreciate it. Anybody have any questions for John?
Jim, we're also talking businesses besides just communities. So if, some
Right.
business wants to come out with 10 people early in the morning, that's great too. And we're working on recognition. How do we recognize these communities and businesses? So a whole lot of work still to be done, but appreciate people letting us know.
Thank you. Thanks, Mark. Appreciate that. Okay. I think that's going to wrap up the meeting for this morning. I do appreciate our speakers. I thank Alex and Adam for sharing with us their views about health and education. We hope you found it to be productive and informative. I think you have. We hope that we'll see you again sometime in September, probably around the 11th. We'll probably be doing virtual again. My guess is we'll be doing this for quite some time. At the end of this, when I close this out, you may see a survey that pops up on your screen. And I am going to recognize one person, Frank Moser, for the moment. But you may see a survey that pops up at the screen. And it's just a few questions as to what you thought of the virtual Zoom meeting of the ECCL. I'm going to try to find Frank again. Okay, here he is. Okay, Frank, you're unmuted, Frank. Sorry, I didn't see you sooner. Please ask your question. Frank? Unmute, Frank. There you go.
I just did. A very quick question. How many people are participating? How big an audience do you all have this morning?
It's roughly about 50.
Oh, great. Well, thank you. That's reassuring. Thank you again.
Yeah, it's a good question. I appreciate that. But we expect, as we've been doing this, it's a lower number personally, but when we blast it out as a recording, we get hundreds of people look at it. So it's getting out there, and I think people appreciate it and appreciate the latitude of either coming online or just watching it, a recording of it. Okay, thanks, Frank. All right, with that, I'm going to adjourn the meeting. Thanks again to all of you for participating. And we'll see you again sometime in September. Thanks all. Take care. Bye-bye.
Thanks.